Good morning. Thank you all for joining us with the Appalachia Funders Network webinar this morning on Impact Investing for Healthy Communities, Fundamentals, Models, and Examples. I'm Susan Zepeda, co-chair of the Health Working Group of the Appalachia Funders Network. As most of you on the call know, Appalachia Funders Network is a group of funders looking for ways to work together for a strong economic transition in Appalachia. In addition to looking for opportunities for collaborative and complementary grant making, we want to be sure we have a shared understanding of all the investment vehicles available to us to support this Appalachian transition. The Health Working Group has had the good fortune to be lead on a planning grant from the Robert Wood Johnson Foundation that has made this webinar possible. So today you'll be hearing from Lisa Richter, who is a principal and co-founder of Avivar Capital, a national SEC-registered impact investment advisory firm that assisted foundations and other and other institutions to design and execute impact investing strategies. And a number of us have known and been working with Lisa for years in other positions before she branched out into Avivar. So welcome, Lisa. After Lisa does her presentation, we'll be hearing an Appalachian perspective from our own Sandra Mickish. Sandra is Deputy Director at Mary Reynolds BABCOCK Foundation, and she's been an early investor, if not to say instigator, of the Appalachia Funders Network and an early adopter of leveraging opportunities in mission-related investment and program-related investment. As Deputy Director, Sandra oversees organizational operations, including investment, finance, human resources, and administration. And she also directs the Foundation's efforts in mission investing. Before joining the Foundation, Sandra had various fundraising and management positions in nonprofit organizations. So Sandra brings both the philanthropic and the nonprofit sector perspectives on what impact investing can offer. So that said, Lisa, let's turn it over to you.
Great. Thank you so much, Susan, and thanks to the Appalachian Funders Network for inviting me to be a part of this dialogue. It's very exciting to think about how we can use impact investing as part of the tools for a transition in a region that has, frankly, a very rich history and we hope a really exciting future as well. So I'm going to move relatively quickly through some of the slides, and there are quite a few slides about impact investing, partly because I actually believe that many of the people on the call are familiar with these concepts, and what will be important today is to refresh our understanding of them, but then most of all to think about what they mean and how they can be used in the transition under consideration, and with particular focus on how we think about building a healthy region, one where there are equitable opportunities for health among all. So with that, I will start to move through the slides. As Susan said, we'll look at fundamentals of impact investing, a little bit on models and even frontiers, and then examples and resources. So impact investing is one term for a practice that allows us to use capital as a tool for social change, so a means to an end. It's part of a larger umbrella of approaches, some of which are called sustainable, responsible, and impact investing, a broader umbrella that includes screening of publicly traded securities, shareholder activism, voting proxies on traded companies, and then also proactive investing, where an investor deliberately seeks out particular investments in order to drive certain social or environmental outcomes. That's really where we're going to focus our conversation today. And for those who have been following the field, the larger umbrella is also often called environmental, social, and governance criteria brought into investment decisions, while our piece that we're going to focus on today, proactive investing, is often called mission investing. There's lots of different language that's used in the field, but basically we're talking about either investing in or driving our capital towards intended social outcomes or managing our holdings in ways that reinforce those outcomes. So moving to a little more granularity on definitions, in the foundation context, impact investing is a philanthropic tool that allows us to drive capital toward measurable social and environmental impact along a financial return. And impact investments can be any asset class or structure, that is cash, fixed income, or debt. Fixed income and debt are two similar words for the same, or two different words for a similar thing, equity. Any expected financial return, such as an interest rate or a dividend or a capital gain. And very importantly, the same fiduciary care as any institutional investment. So we're not talking about relaxing the criteria of identifying and managing investment risks, but instead we're talking about bringing the added discipline of looking for how we can drive and reinforce social and environmental goals along with our financial goals. And you'll see in the spectrum below that many of you probably have known over the years, this was originally created by the Heron Foundation, a laying out of these different asset classes. So to the far left, we have the one that really has no expected financial return, grants. Sometimes we can structure grants as recoverable grants where we do get back the principal of the money that we've put into an organization or a project, but we don't get an interest rate or dividend on it. But many people consider grants and recoverable grants as part of their investment toolkit. And we'll talk later about how grants and investments, financial investments, can sometimes work together. On this far left-hand side, you'll see we've got essentially the spotlight on it. This is program-related investment, and that's the area where I understand the Appalachian Funders Network is most interested in considering how these approaches can help the current strategies. So we start on the left with the grants. We also can do alternatives, which are venture capital, real estate investments, timber investments, and we added here novel structures such as pay for success or social impact bonds. These are things that are potentially quite risky, but interesting and can deliver both financial and social return. Fixed income, which as I said earlier is another word that really refers to debt or extending loans where we have an expectation of being repaid at a certain point in time and usually along with some interest rate paid on top of that. Cash, which are usually insured deposits in banks or credit unions, but we can also sometimes have so-called cash equivalents, which might be a little bit different, maybe a money market account. Guarantees, a very special form of impact investing where some party pledges to repay a loan if the original borrower is not able to repay. Those can be structured as program-related investments or as market rate investments. And then as I move over to the right-hand side of this spectrum, these are, as you can see, very similar asset classes or names for the structures, but on this right-hand side, investors are seeking a market rate risk-adjusted expected financial return, so just what they would seek on any endowment investment, and the difference being that on the left-hand side where we put spotlight and we've called it out as program-related investment, the investor is willing to be a little more flexible in order to drive charitable and social outcomes. We'll say more about this in a moment. I'm going to leave this slide for now, although I know there is a lot of information here. We'll be reinforcing it as we go, and we'll certainly be open to questions. Moving on, I think it's useful to stand back and just say, for any financial investment, what's the key difference between a grant and an investment? In both cases, we are deploying a financial resource in favor of a social thesis, some mission or goal that we're trying to accomplish. And for purposes of this conversation, it's building healthy communities. And really, since we're partially funded here by Robert Wood Johnson Foundation, we'll look for ways to reinforce their important new concept of a culture of health. We would want these objectives whether we were making a grant or a financial investment. What's different with the financial investment is we also look for an investment thesis, which is some explanation of how the investment will repay. So will the investment repay because it's going to go into an organization that has recurring revenue, regular revenue, or might that organization perhaps be about to experience some savings that would allow repaying an investment? That might happen if there were going to be some energy efficiency improvements, for example, or perhaps if two organizations were to co-locate into one space and lower their operating costs. They might need some financing to get that done, but they'd have some savings that could help repay an investment. Or perhaps the investment would go into a for-profit entity that was going to grow, and the repayment of the investment could come out of the growth of that for-profit entity that might throw off dividends to its shareholders or might later be sold and have a so-called liquidity event where the organization is sold, it receives payment, and can repay its investors. When we put together a social thesis plus an investment thesis, then we have an impact investment. Now, the focus of Avivar's work with Appalachian Funders Network is really on program-related investing, which is that investing that we highlighted on the left hand of the spectrum earlier, where the investor is willing to take a below-market rate risk-adjusted financial return. PRIs, as they're known, are defined for private foundations in the tax code of 1969. The term is also borrowed by community foundations and used in roughly the same way. But the definition for private foundations is set out as follows. It's a three-pronged definition. The primary purpose is that the investment is for charitable purpose, and in the code it's stated a little more with a little more detail and nuance. But usually we say the primary purpose is charitable. The second prong, no significant purpose, is the production of income or the appreciation of property or capital. We often use a shorthand here saying that no conventional investor would make this investment on the same terms. And we're making it for the charitable purpose. So we say even we wouldn't make the investment but for the charitable purpose. This investment would not happen but for the charitable purpose. And then finally, the third prong, no purpose, is lobbying or other political maneuvering that's prohibited to nonprofit organizations. So three prongs. Primary purpose is charitable. No significant purpose is the production of income or the appreciation of property. And no purpose is lobbying. I do want to go back on the second prong once again, just for a moment before we leave this slide, to say that this is where we come to the idea that PRIs are quote-unquote below market rate. Since we're not seeking income as a primary objective, or we're not seeking capital gains, that means we're willing to accept a below market rate investment, or we may be willing to accept a higher level of risk for a similar return on the investment in order to drive charitable purpose. And we'll hear quite a bit more about that in a moment. Moving on to the next slide, why are PRIs needed? And you might have noticed on the cover slide to our webinar today, we had a map of Appalachia which showed the distribution of small business loans by CDFIs, Community Development Financial Institutions. Those are mission-driven lenders, as I believe everyone on the call probably knows. But even through those institutions, we don't have a lot of capital flowing out to communities. And there are challenges in getting capital to communities. Some of the challenges that we see, particularly with conventional investors, are that conventional investors allocate capital to efficient, quote-unquote, typically profit-maximizing transactions. And these transactions are typically large, and predictable, and the repayment is predictable, and usually it's hoped for in a relatively short period of time. Regrettably, the investment opportunities in the communities where we're focused don't have those characteristics. They seldom fit in that conventional box. In communities of color, in rural communities, and even in innovative sectors, any sector that is less familiar and more complex to the conventional investor, we find that capital does not flow as readily. And therefore, in order to drive capital into those very important communities and activities, we need investors who are driving for the social and or environmental purpose. We can also see, thinking back to that cover slide, that because of the barriers to capital flowing into low-income, rural, and some of the other underserved communities we talked about, the scale of need is actually very significant. And therefore, to mobilize the amount of needed capital, we usually need to put together what are sometimes called blended pools or capital stacks, and we'll see them in a moment, that create risk management for the larger investors who remain the conventional investors by and large. The other thing that we can do, and this is where we come to the opportunity up at the headline of this slide. We've talked about the need, but the opportunity for PRI is to come in early in the development of an organization, of a community, of a project, to help it get along through those formative stages and experimental stages, so that we have proof of concept on what we're trying to accomplish, and then we can begin to attract other investors in. This is where PRI becomes so catalytic, and this is why it's so important in a strategy such as the Appalachian Funders Network is considering. So to give a little more clarity on that, if we think about organizational growth, and this could also even be true in the planning of a project, there's usually a startup phase, and during that phase, there may be grant support. If we were thinking of a small business as our organization, often the business entrepreneur looks to family and friends, or looks to their own savings to get something started. But the bottom line is, in the early stages, usually the expenses of launching an organization or a project are greater than any revenues that are being generated. But if the organization or the venture has promise, it will be able to earn some revenues, build a customer base, or whatever that may take, and reach a break-even point, which here we call the proof of concept as well. And if this is a venture that has social or environmental benefit, we're really going to want to scale it. We're either going to want to reach more customers or beneficiaries in the current market, or perhaps replicate elsewhere. And in order to take this to a larger scale, we typically need a significant infusion of capital. Well, it's at that point that grant capital may not be enough to take us to full distance, and we may have an opportunity to blend in some flexible, patient investment capital, such as program-related investment, to help us get through the growth stage. And hopefully, if the initial model was viable, we'll get to another larger level, break-even point, and then have the so-called sustainable operation. I do want to add that we've discovered in our field of trying to reach customers in markets that are underserved, that we may never be fully self-supporting just through operations. Some of our organizations will always need to continue to raise some grant support, either for innovation or perhaps for capacity building services, certain activities that may not in and of themselves garner revenue. And that's okay, as long as we understand it, plan for it, and learn how to keep it going. But this is a model for how program-related investment can be used early in the phases of an organization or a project, helping it to get proven out, helping it potentially to scale and reach levels where it can bring in more capital. I'm going to go to another model By the way, the one we just talked about, I sometimes like to call leverage that's achieved over time. With the so-called capital stack, we have leverage that's essentially achieved at a moment in time, even though the benefits may be realized over time. In the capital stack, we are blending different sources of capital that have different risk tolerance. And I'm just going to cite an example from one of my colleagues, Tina Castro. She likes to compare the capital stack to a multi-floor apartment building. And if we were in such a building and we had a flood, the basement would be the first place to take some damage. If it was a very serious flood, we'd get some damage on the first floor. And if it was truly apocalyptic, we'd get damage up in the higher levels. And it's a good analogy because what we're trying to achieve with the capital stack is in the so-called first loss tranche or lower level, we're trying to achieve what's called credit enhancement or loss protection. We have sources of capital there, sometimes sources of grant capital or public subsidy that will absorb any losses that occur in a lending operation that's about to take place once we get this capital assembled. In the next tranche up, we often have so-called subordinated debt or junior debt that would be the next level to absorb some losses if there were significant losses. And with those lower levels of credit enhancement in place, we're able to leverage the very large, always much larger, dollars of the conventional marketplace, often coming from banks who are fulfilling the Community Reinvestment Act or other conventional market actors who are willing to get on board when the credit enhancement is there. And so this is a capital stack. And we'll understand as we think about examples later in the discussion how both of these forms of leverage are important and the critical role that PRA plays in both. So earlier we said when we leverage over time, PRI investors are usually early investors. In the capital stack, I want to be sure to point out that PRI investors are usually in the middle stacks there, the subordinated or junior debt that makes it possible for the senior lenders to feel comfortable getting on board. We're going to move on now and say that once we have these concepts and tools in our arsenal, how can we deploy them to advance a vision of healthier communities? And here we're talking about health very broadly defined, the kind of health that we would envision for a region like Appalachia, where we're going for much more than just the absence of disease. Surely we want the absence of disease, but we also want to be able to support physical, mental, and social well-being, and to call out some of the great work that I know has already been done in the region, also to create wealth that can be circulated within the region, so to enable a healthy, wealthy, and thriving region. What's interesting for many of us who started our careers in the field of community development and began to realize that the field of community development was not really able to fulfill its potential in communities where there were significant health burdens. And we began to look at what the field of health was trying to achieve, such as set out here in Health and Human Services, Healthy People 2020 goals. Many of us were taken aback by the significant overlap of goals. So Healthy People 2020 is calling for the nation to attain high quality, longer lives, health equity and eliminating disparities. Certainly eliminating disparities has always been a core value in the community development field. Creating social and physical environments that promote good health. Community development is all about creating vibrant social and physical environments, and how lovely to think about also promoting good health. And then to promote quality of life, healthy development, and healthy behaviors across all life stages is a perfect vision, I think, that brings together health and community development and sets the stage for a broader and more holistic practice across both fields. Just as every patient in the healthcare field has individual needs, every community is unique. And I believe that's acknowledged in Appalachia by the sub-regions. But just very quickly before we move on from this slide, even when we think about one of the core functions of community development, which is affordable housing development, that looks very different depending on where it's taking place. And while I'm sorry I don't have an example from Fahi, one of the great affordable housing development actors in Appalachia, we can see here urban Los Angeles, a manufactured home in New Hampshire, a self-help built home on the Pine Ridge Reservation, and a houseboat affordable housing development in Marin County. How different something like affordable housing can be in different places. And part of the opportunity we have with PRI is to discover how to best unlock our potential in our individual regions, whether it's for how housing should be developed, how small business might be developed, and so on. We'll talk more about it as we go on. Now, what we can do with these tools of program-related investment and a vision of healthy and equitable communities is we can start to program our investment strategy to target populations who are underserved, who are vulnerable, who experience disparity. We can target our capital into geographies that are underserved, urban and rural, and of course there are urban and rural communities within Appalachia, increasingly also suburban communities which are suffering from challenges in both health and community development, sectors that can help us unlock our health and economic potential, ownership structures that allow us to increase our local and our democratic ownership so that interests are aligned between those who own the means of wealth creation and those who would hold the wealth locally, who need to earn incomes and create savings and have permanent sources of jobs. And finally, governance. Representative and accountable governance, again, that aligns the interests of development, be it housing, be it business, etc., with the health and well-being of local residents and communities. That's the vision. How does it become real? Well, impact investors look for tangible metrics of their social benefit, and they can think about these at the outset before they make investments, as well as once the investments are outstanding and they are monitoring those investments to see whether the intended outcomes are being achieved. So if we're talking about housing, nowadays we can look for it to not only be affordable, but we can look for it to be healthy, which in the housing context means using non-toxic materials, being walkable, being transit-oriented, among other things, being situated in a place that has other services nearby. If we're talking about, let's say, a health sector business, the number or proportion of vulnerable patients served. If we're talking about building facilities, the square feet of facilities that serve the underserved. If we're talking about child care or education, the number of slots created for the underserved, and also the quality of the services provided. If we're talking about green space for safe physical activity, the square miles that are accessible to lower income people. Certainly if we're talking about creating access to healthy food, the number of people that gain access, particularly those that are underserved, and then when we're talking about job creation, jobs that are created and accessible for low-income residents and those who are otherwise challenged, and also the quality of those jobs. Do they have career ladders? Do they have benefits? Are they healthy for the worker? And in terms of small businesses, to be sure that loans are reaching all entrepreneurs who have viable ideas, and often too that they're packaged with services that help entrepreneurs to develop their capacity. So these are some of the metrics that we look for. Now I'm going to just step outside of my logical progression here for a moment. I hope it's logical, just to say that we are undertaking all these activities in a long arc of the practice that's been under development for now over 50 years. And certainly it's been under development in Appalachia as well as elsewhere in the nation and the world. We have some of the best community development financial institutions or mission-driven intermediaries, as well as some very innovative impact investing foundations in Appalachia. So it's exciting to look at this kind of sort of a snapshot of the nation's progress and know that some of it has occurred in Appalachia and there's much to build on. But what this slide is all about is that we achieve progress, it seems, through an interplay of public sector efforts, policy that is, private sector efforts, associations, principles that are articulated, like the Sullivan principles that help to unlock apartheid in South Africa, the Series principles that put carbon reporting on the map, and other principles that have come forward from time to time. And then how the policy and the principles and associations work together with the capital markets to generate impact investing opportunities. And we can see over the decades that we have truly expanded the range of impact investment to different sectors. And in so doing, we have created a marketplace where today we are poised to be able to drive capital to create healthy communities. And we can also bring together the investment of capital with other efforts to create a culture of health. And I would argue that we won't be able to achieve a culture of health or healthy places unless we, in a very significant way, are deploying capital to reinforce those goals. Very quickly, I just want to say the early community development was affordable housing, small business lending in rural and urban America. Microenterprise got its launch in developing countries, but we brought it into this country a little bit later. Environmental conservation really grew out of Earth Day in the 70s and began to be a major area of impact investing, program-related investing by the Packard Foundation starting in the 1980s when they began to make loans that allowed for the securing of major conservation lands. Educational innovation became a focus of impact investing in the 90s. The whole charter school movement would likely not exist were it not for Prudential as an impact investor early on, and then later others who supported community development financial institutions who have now made billions of dollars of loans to charter schools. And the benefits there have been not only in some innovation and some demonstration that our achievement gap does not need to be there. We have the tools to get around that achievement gap, but some of those demonstrations have also motivated larger changes in district schools. But we all know that there's a great long distance yet to go in that field. Critically important to health outcomes. Another thing that happened in the 90s was that we realized that changing the conditions in the communities we serve was not going to happen just by virtue of extending more democratic credit or increasing access to credit. We learned that households and businesses also needed to learn how to save, how to build assets, and that became a very important additional focus of impact investing and community development in the 90s. In the 2000s, we really saw the move towards social enterprise and thinking about ways that we can generate revenue while we drive social change, whether through nonprofit organizations or through businesses that are designed for social as well as environmental return. And we also saw the benefits of technology in helping us advance and democratize change. And those efforts all continued into the 2010s and where we are now, where we're bringing the field of impact investing to catalyzing healthy local food systems. We're certainly bringing it into the area in many ways of trying to improve health outcomes, transit-oriented development, arts and culture, and we're coming to a holistic vision where in many impact investments today, we try to overlay all of these goals. So as I said, affordable housing nowadays will also try to take into consideration healthy materials, transit orientation, co-location with a health clinic or having a nearby health clinic, access to quality schools, etc. And similarly in the workplace, we're thinking about benefits, worker wellness, sustainable products and processes. And so there's a great deal of potential. The question becomes how we unlock it for every region and every population, and that's where I hope we'll have some discussion later in the call. Moving along, we drive this change because more investors are getting interested in the potential of capital as one of the tools in the toolkit. And that's clearly the case for individuals who want to align their values with their investing. That's what we're calling local stakeholders here. Local stakeholders also include locally based financial institutions, such as community development financial institutions, such as the slow money groups that we're seeing forming around the country, such as even civic-minded community banks. And I know that there are some in Appalachia. Community foundations, I believe there are some on the call. They envision a healthy community for all and are increasingly looking at how impact investing can play into that agenda. Private foundations who may also have a place-based focus or who may have a sectoral focus that they can bring to bear within place-based strategies. Faith-based investors who, along with foundations, were some of the originators of impact investing, are often very important investors into local CDFIs and affordable housing development. Health systems are newer entrants into the field, but very important through their community benefit obligations under the Affordable Care Act. They are increasingly asking themselves what the community health needs are and how they can respond, and increasingly they're partnering with impact investors to support community-based efforts, either through their grant support or in some cases by making investments. Banks who have had an obligation since 1977 to fulfill the Community Reinvestment Act that calls for them to invest in all of their service areas, including the low-income regions. They are very important partners in impact investing, but often don't come in unless that credit enhancement is in place that we discussed earlier. Similarly, for the pension and insurance companies who may come along when credit enhancement is in place, and they're sometimes motivated by wanting to avoid something like the CRA being applied to them. Increasingly, we see other corporations wanting to participate in impact investing as a way of positive branding. And finally, government, which can be an investor, but oftentimes is a partner who helps to create the credit enhancement either through grants or through tax credit programs or guarantee programs, and is essential to our work. Just want to point out that even within the Appalachian states, there are foundations that are already active impact investors and others who are actively looking at impact investing as a channel for future activity. And these are members of the Mission Investors Exchange, which is a trade association focused on impact investing. How does all of this come together? Well, we build from our some of our more conventional tools as foundations, the practice and tradition of asserting leadership, either in a community or sometimes for a theme or sector, setting out vision for change, backing that up with grant money that enables community actors to build their capacity in Appalachia, and I hope we talk a little bit further about this later in the call. There's been wonderful work to think about value chains as one of the ways to spur wealth creation within a region. There is grant making that supports capacity building, that helps organizations and businesses and households to become ready to take on loans or investments. There is grant making that spurs innovation for what's needed, and so on. And so we find that a lot of the change that we're trying to drive as we move towards healthy communities starts with vision, complemented by grants and subsidy. That sets the stage for early investing by program-related investors, such as we saw in the earlier slide of the life course of the organization. Once there's further proof of concept, we're able to bring in larger dollars and a broader mix of investors, CRA banks, sometimes mission-related investors who will place market rate investments in our strategies. And then the vision, which for now, of course, remains aspirational, but is nevertheless there, is that as we continue to drive all these things in consort, we really change the way the marketplace operates so that it is designed to help to achieve healthy outcomes and sustainable outcomes and equitable outcomes. I think we're seeing those changes take place in the market, but they're slow and they're not without periodic setbacks. So we have a set of tools, we have a vision for what's possible. How do we implement? As investors, Our Capital has found it useful to think of the implementation of impact investing in terms of a life cycle. And unlike a roadmap, it doesn't have just one starting point. We find that investors are likely to start anywhere in this life cycle, and as they move towards increasing involvement with impact investing, they build in the steps over time. But often a first step is planning and saying, if I want to start to deploy capital to drive social or environmental change, what is my opportunity set? What are the needs in the community, and how can I address those? Where does investment fit in addressing those needs? Who's already doing it? Who can I partner with? Who can I learn from? What do I need to change within my organization in order to execute? And that process may go on for some time, and the institution may be investing while it continues to plan. It may be, in fact, quite a while before the investor decides to formalize those activities into an investment policy, perhaps formalizing certain risk and return objectives and a policy for managing risk, but that step of formalizing policy becomes helpful down the road. And then there may be a formalization of how to execute impact investing within the foundation, how to staff, when to use consultants, how to monitor a portfolio once it's in place. And then finally, and I'm now in, as I think if you're following, you'll know I'm in the southwest quadrant here. How do you manage this activity and integrate it with everything else that a foundation is trying to accomplish? And I just want to say the purpose of presenting this slide here is for the foundations on the call to think about what their processes might be internally, but also for anyone else who is thinking about trying to use impact investing as a tool or attract it to a region to understand how the foundation may be thinking and where the access points may be for dialogue with a foundation on their strategy and perhaps even offering to help with their strategy. On the next slide, we take a closer look at what can be very helpful in a landscape scan. So we may want to, in the northwest quadrant here, the upper left-hand, well, first of all, there's a step that's not articulated here that I think is the backdrop. And if you think about the purpose of a program-related investment, the primary purpose is a charitable purpose, and it's usually addressing an unmet need of some kind for us as impact investors who care about a region. So there's a backdrop question to all of this, saying what needs are we trying to address? And on this call, we're talking about how we can build healthier and more equitable communities within Appalachia. So then we can ask, well, what are the investable sectors? What kinds of organizations have that repayment capacity? Well, first of all, are aligned with our mission, but then that's the social thesis, you may recall. but then have the repayment capacity that would make it possible for us to consider an investment. So we begin to cultivate a pipeline, if you will, of potential investments there. And we may look in one sector if we particularly care about something like small business creation or local food systems or health, or we may look in several sectors if we care about comprehensive development within place. We're also going to want to look at who is already investing in the upper right-hand corner. Who might we partner with, learn from, leverage our own dollars with, share risk with, share the expense of investing with? That's very important. The government partners on the lower right-hand, they will be the sources of technical assistance sometimes. They may be the sources of some of the revenue streams that are going to enable the repayment of our loans or investments. I'm thinking, for example, of Medicaid payments that go into federally qualified health centers, Section 8 payments that go into rental housing, per pupil revenues that go into any kind of a school. And then they also are the source of insurance programs like the USDA's loan guarantees, the SBA's loan guarantees, and tax credit programs such as the New Markets Tax Credit, the Low-Income Housing Tax Credit, et cetera. Very important to our work. And then finally, perhaps not fully appreciated until recent years, the market building and research partners that enable us to better understand our marketplace, track local needs, develop metric systems to track our progress and to monitor our progress, to help us make mid-course corrections and so on, and to support individual organizations who need capacity building. So we'll typically want to map all of this out in the process of developing a strategy. Now, when we take impact investing into place, generally speaking, we find investors have some kind of prioritization of what they're trying to achieve. And this is a bullseye that's borrowed from the Meyer Memorial Trust in Oregon. And we can see that their goals are environmental, social, and economic, which for them very much includes equitable economic benefits. And they're looking for where they can realize those benefits within their state. But because they believe impact investing is valuable as a general approach, and they want to align as much of their asset base as they can to their overall vision, they'll also be willing to consider investments in a wider region. They'll then, if they can't find investments in the region, but there's some outstanding examples that come to them that are way outside the region, they'll do that. Then they would consider investments that are at least neutral and not doing harm. But in their case, they avoid investments that they think are harmful. Now, here I want to be clear, I'm not just talking about PRIs, but I'm talking about a vision for thinking about investing in general. For Meyer, their program-related investments would be the ones that would most likely be right in the bullseye. There they'd be trying to realize environmental, social, or economic impact within their region. And for foundations on the call, that would likely be the case as well with your program-related investing. But over time, you might consider aligning all of your assets and at least being sure that the assets are not undermining your primary purpose. Before leaving this slide, I want to say some foundations choose to hold on to investments that are in that outer red ring and use the so-called active ownership to agitate companies to try to drive change. And I believe some of that is going on in Appalachia as well. I think we see some of both of those strategies. To come back to the more focused question of how we drive toward a healthier and more equitable region, we find it very helpful to look to the county health rankings, where once again we see the amazing overlap, frankly, between what we need for vital communities and what we need for good health. So this is a so-called evidence-based model developed at the University of Wisconsin, their population health unit, which has really been outstanding and is also a partner with Robert Wood Johnson Foundation. And through their research, they found that in order to achieve the health outcomes of quality of life as well as length of life at the very top there, using the medical terminology, that morbidity and mortality sort of in the negative forms, but in the positive, quality of life and length of life, really the drivers that are involved are largely factors that we address through community development. So their model suggests that 10% of what is needed to reach or to optimize quality of life and length of life is in the characteristics of the built environment. Affordable housing, access to fresh food, green space for exercise. And then 40% socioeconomic factors, and you see them there. And just 20% in their model is really access to and quality of care. It's got to be there, but it's not the primary driver. And when we have those things in place, a healthy physical environment, socioeconomic opportunity, and access to care, then we create an environment where our communities can make healthy choices and have healthy behaviors, which we see is a huge driver of the outcomes, 30%. But if we don't have a healthy environment, it's very hard to make healthy choices. And I know that that's something that Appalachia has experienced in terms of, at times, lack of access to jobs that are safe, lack of access to healthy food, and so on. The good news is that the field of impact investing, through that 50-year arc of experience that I shared, has tested models for investing in ways that help to put in place these necessary drivers of a healthy community. And we'll see in some of the examples, there have been financings of health centers all across the country, federally qualified health centers and similar ones. There's been impact investing in health tech that does things like enable a specialist, be it a dermatologist or a radiologist, to have communication with a rural federally qualified health center so that even patients in remote areas can get the specialist care they need. There have been models, lots of models of financing child care led by, among others, self-help, credit union based in North Carolina and serving portions of Appalachia, microenterprise, small business. There's some wonderful small business lenders and investors right there in eastern Kentucky, Kentucky Highlands, Mayhead, and others. Anchor institution strategies, which we'll talk about a little bit more in a moment, banks and credit unions offering safe and sound non-predatory services. All of these necessary components of health have proven models for impact investing to help them get established and grow. I'm going to talk a little bit about the frontier. We've got the proven models, and they're sort of, in today's world, often used one here, one there. We think the future is going to call for coordinating these investment strategies within place, because really that county health care model, county health rankings model, tells us that we need to coordinate all of these factors to optimize our opportunity for quality and quantity of life. And so there are a cluster of activities related to the built environment, a cluster with socioeconomic factors, and a cluster with access to and quality of care. I mentioned anchor institutions. The best known example today is in Cleveland, where a whole cohort of hospitals and universities and museums that are located on Cleveland's eastern side have banded together for some joint purchasing, which is linked up with worker-owned and community-based small businesses in the region who are now their laundry vendors, who have a greenhouse that supplies fresh green lettuce, and who do some solar paneling. But the concept of leveraging an anchor institution to spur economic development can have much broader benefits. And in different anchor institution models around the country, we see that sometimes the anchor will create employee-assisted housing to motivate affordable housing development around their campus so that workers can live nearby and can have transit-oriented housing. We see increasingly that the anchor institutions are creating whole new meal service programs, be they hospitals or be they schools, that are farm to institution. There are movements to generate more suppliers to these anchors and use that as a way to generate local small business and so on. This really ties to the wealth works and local wealth creation and value chain concept that I know is being developed in various parts of Appalachia and is often set out with the food system as an example, where we try to connect businesses and owners in the local agricultural base to local businesses that can be the aggregators and distributors of agricultural and food system product, and then deliver that to the local retail and institutional customers so that we both increase the circulation of dollars in this segment of the economy within our region, and we also reduce footprint, and oftentimes we get a much better product because it's fresher, it's healthier, etc. So another frontier to think about in Appalachia. Finally, I just want to say in terms of frontiers that we're better understanding the importance of investing early, of moving the investment of our capital up to being preventative so that we have prevention versus intervention. We're understanding that if we place investment capital in social services as well as healthcare early in the life course, even prenatally, we're able to set the stage for healthier children and families. And frankly, we can avoid some of the very costly remediation that now absorbs so much of our public as well as private dollar. Similarly, if we can adapt innovative approaches to preventative care and early identification of disease, we can lower our very unwieldy healthcare costs and free up resources to address disparity and create more equitable access to health. With that overview of what's possible, I do want to turn to some examples, and I'm really thrilled to first be able to hand the panel over to Sandra Mikic, Deputy Director of Mary Reynolds BABCOCK Foundation, as Susan described nicely at the beginning. And Sandra, I know this has been a sort of an epic overview, but I also know that Mary Reynolds BABCOCK Foundation has been actively involved in virtually every stage of what I've talked about. I know that you're going to pull out one example, and I just want to say we're thrilled to have you here and see how maybe some of what I've said can connect to your comments on Mary Reynolds BABCOCK Foundation's work.
That's great. Thank you. Can everybody hear me okay? So I wanted to just, let me tell you just the briefest overview of our PRI program. I'm not sure I have control, so if someone can connect to that slide, maybe I'm having some technical difficulties today, sorry.
What we see, Sandra, is we see the slide with a snapshot of Mary Reynolds BABCOCK Foundation.
Great.
Do you want? Okay. Shall I move to the investment?
No, leave it there for just a minute, and I'll tell you in a minute. Thank you. So we've been making PRIs since the early '80s, but we really built out our strategic portfolio in the last 10 years. And as a regional foundation working in Appalachia and across the South, we have focused our PRI efforts on CDFIs, which Lisa mentioned, Community Development Financial Institutions. We see them as critical infrastructure for achieving our mission, which is moving people and places out of poverty. And the other real advantage for us in focusing on CDFIs is that as intermediaries, they really have the expertise, the lending and investment expertise, as well as capacity for technical assistance that we just don't have. And so it has really reduced the barriers to us as a foundation for making PRIs. So I think that's the main kind of summary statement I want to make. One of the things we see we see really three things that CDFIs do extremely well. One is they provide access to capital for low wealth people and low wealth communities for things that matter to us: small business development, affordable housing, community facilities, all the things that make up a healthy community. They also, as I mentioned, provide technical assistance for entrepreneurs and for rural communities that don't have the expertise on their staffs. And one of the things that we talked a lot about access to capital, but I think it's equally important to understand the critical role of technical assistance for entrepreneurs, whether they're in startup businesses or growing businesses, as well as for communities that need to understand all the different funding opportunities and other technical expertise they need to put together a development project. And then the third thing that CDFIs do is that they are excellent partners for community and regional initiatives, and I'm going to describe one in a few minutes, but they have relationships with the government sector, with banks, with businesses, with nonprofits, and so they really can be an important glue to pull together community initiatives. So they're great partners. So now I would love to move to the next slide. We use PRIs in Appalachia to support our core strategy of we share with the Appalachia Funders Network of helping to create a just and sustainable economic transition in the region. And we've made many, many PRI investments in Appalachia, including some of the groups that I think Lisa mentioned, but MESA in Eastern Kentucky, Mountain Association for Community Economic Development, that works in small business development in some key sectors. FAHI, that Lisa also mentioned, Federation for Appalachian Housing Enterprises. It's a regional organization that works on affordable housing and community facilities. Mountain BizWorks in Western North Carolina does a lot of small business development. They've got a real area of expertise around entrepreneurial training for Latino entrepreneurs. And then the one I want to focus on and tell a little story about is the Natural Capital Investment Fund. And the story here is not just how we've used PRIs to support them, but how we've combined grants and PRIs over a long period of time, really 12 years, to help Natural Capital Investment Fund grow. They came to us asking for a PRI when we were just beginning to build out our new PRI portfolio 10 or 12 years ago, and we were naive and they were naive about whether they were ready for a PRI. We learned that they weren't, but instead of walking away from the opportunity, we realized that we could still help them grow. We appreciated their vision for what they could be and do in the region. And so we essentially combined a number of investments over a long period of time. We made operating grants to help them begin operations in the early years, mostly around providing technical assistance to natural resource-based businesses. We helped them build organizational capacity to really build out their financial, internal financial strength and other and staffing capacity to grow. We also, there were key points in their growth where we provided very small grants for strategic planning that helped them understand whether they could grow into new regions and new geographic areas. And then we made a capital grant, and I think it's important to understand that in addition to operating grants and organizational development grants, we can make capital grants to organizations that, like CDFIs, that can strengthen their balance sheet and provide them permanent capital that they can leverage for their own growth, for finding more, attracting more debt from other lenders, and increasing their self-sufficiency. And then finally, the last investment we made in this number of types of investments was a PRI. And we staged our PRI because they had a pretty small lending pool. And to protect ourselves, we don't make PRIs for more than 10% of loans under assets under management for a single CDFI. So we staged our investment. We started with $100,000 because they had $1 million loan fund, but we made a commitment to increase that over time as they grew. And so we now have a $500,000 PRI. They've blown past that $5 million that they grew toward to attract our PRI, and they're now more than a $15 million loan fund, and they work in 8 states. And you can see on the slide the impact around jobs and financing, but I wanted to just highlight some examples that I think are really relevant to the folks on the call of the kinds of things they've done. Recently, they were able, one of the states they expanded into, they started in West Virginia but now work in 8 states, including all of the Central Appalachian region. But recently in North Carolina, they were part of a consortium that made a multi-million-dollar loan to 2 food co-ops in North Carolina. And this was a very complicated deal. It required lots of partners with specialized knowledge. They were able to bring in lenders and partners that understood the unusual ownership structure of co-ops. Traditional lenders wouldn't touch this kind of loan. It's way too complicated. But what they were able to do is make these loans for these food co-ops that provide healthy food access for the low-income members of the co-op. It provides a key market for local funders, and it provided good jobs for co-op employees. These co-ops are committed to hiring people from the low-income neighborhoods they serve, and one of the co-ops doubled its staff to 30 with the expansion. Another example that talks about this collaborative role that Natural Capital Investment Fund and other CDFIs play is that NCIF was the key to, or was a key partner in winning an $800,000 federal grant through the Rural Jobs Accelerator program to create the West Virginia Value Chain Cluster Initiative. And Lisa talked earlier about value chains, and many of you on the call are involved in this work. But this supports 4 regional clusters covering 17 counties in West Virginia. And it provides business technical assistance, coaching for companies and initiatives that are part of the local food system. And it provides this kind of support for producers and farmers, for processors, for aggregators, for distributors, all across throughout the value chain for the local food system. And the ultimate goal is to build a profitable, equitable supply chain in each of these 4 regions. So, our driving goal much of the time is good jobs, and but you can see with these kinds of initiatives, it's good jobs and strong businesses and a healthy food system. And then the last example I'll give is many CDFIs work really closely together, and Natural Capital Investment Fund and NACID have collaborated on building expertise around energy efficiency, which is a huge driver for, it's a huge cost. Energy is a huge cost for certain businesses, including grocery stores. And I think as you think about what's required for healthy communities in Appalachia, we know that local grocery stores are critical. They provide access to food, they provide jobs, they often anchor downtown development and mainstream development. NACID had kind of created this expertise around energy efficiency lending, where they provide energy audits, knowledge about grants and rebates that are accessible to the business owners, and then making the loans themselves. They shared this information with Natural Capital Investment Fund, and together, the two CDFIs have made a number of investments, loans to local grocery stores. An example recently that Mesa worked with in Isom, Kentucky, was an IGA where the owner was started as a cashier 30 years ago and then bought the business several years ago and employs 30 people and provides obvious access to food in the local community. And energy efficiency upgrades to lighting, which are a huge part of the cost of local grocery stores, allowed her to reduce overhead, retain jobs, and keep lower prices for her consumers. So I just wanted to run through a few examples of how CDFIs are making a difference in Appalachia and how PRIs and grants from foundations can support CDFIs. Yeah, our goal is to get to the ultimate outcomes of jobs and capacity in communities, but also we want to help sustain these CDFIs. Our low cost of capital through PRIs and our grants helps them build their self-sufficiency and become more sustainable so that they're important, healthy parts of the infrastructure for addressing poverty and creating healthy communities in Appalachia. So I'll stop there, and Lisa, feel free to encourage me to talk about something else if you want me to cover anything else.
Sandra, that was wonderful. Thank you so much. Just great. I think what I will do is move on quickly because we're just we want to leave time for discussion. So I threw in one other example from another foundation that has made PRIs in the South. This is the Mary Black Foundation. And I wanted to mention this one because Mary Black Foundation has a focus on early childhood, which, as we saw, is so important. Their initial foray into impact investing was really in how they purchased and managed their building, which includes a community space. So it's a charitable use of part of that space. But more significantly, they took responsibility and leadership in renovating one of their park district facilities, so a public building, and were able to use the New Markets tax credit to do this. And because of that, we're able to bring about this really amazing park district facility that was in a park that was in between a lower income neighborhood and a more affluent neighborhood, and really spurred the greater involvement of both communities, and particularly provided an opportunity for those in the lower income community to have healthier physical activity. There was an after school center there, a teaching kitchen, and a bunch of things that could promote health. Wonderful example, and in that case actually the city government was one of the lenders. So a real partnership between the foundation, the city government, and a federal program. That ends the live examples, if you will, and the formal presentation. I hope there's a way that this slide deck can be made available to everyone, because we do have a few other examples in the back, and some of these are specifically related to trying to address childhood obesity. So just very quickly, Playworks is a nonprofit organization that supports recess and play within communities serving low-income schools, and has received loans for its national expansion. Revolution Foods, you may have heard of, it's a for-profit company. So here, the impact investment was largely equity investment into the for-profit company, but one with a social purpose to create healthy meals and education about healthy food within school districts. And they have been expanding rapidly around the country. The California Endowment is a lender to community health centers, and I believe there are lenders to community health centers among foundations in the Southeast and Appalachia as well. The California Healthcare Foundation has a very innovative equity investment portfolio into disruptive technologies specifically if they will improve access to care to at least 100,000 people in the state of California, or dramatically lower cost, I want to say by 25 million statewide. And that may not sound relevant to Appalachia, but some of the innovations that have been backed are for remote healthcare into rural sites. And this one
if I could just interrupt, this is Susan. We were also one of the early investors in Propeller Health. We did it as a grant, though, rather than as a impact investment.
Susan, that's fantastic. I'll just very quickly say it puts a chip into an asthma inhaler and then helps to gather all kinds of information about the environmental conditions that trigger asthma and helps to lead to prevention and management of that disease. Corporation for Supportive Housing mixes supportive services for those who are homeless or have behavioral issues with housing. Some of these things greatly reduce the amount of people coming into the emergency room, both Propeller Health with the asthma intervention and supportive housing. And then Evergreen Cooperatives are the businesses that work with the Anchor Institution in Cleveland that we already discussed. So those are just a few more examples. We included some resources here at the end, and I think for now we should very much open it up to questions. I'm going to zip back to the front slide, but would love to hear questions from those on the call for any of us who have spoken today.
And we will work with Rural Support Partners to put this on the website that supports the Appalachia Funders Network.
Fantastic. And by the way, if you don't have questions but you'd like to share with us something you're either thinking about doing in impact investing or are doing or are seeing somebody else do in your community, we'd love to hear about it.
Ladies and gentlemen, if you would like to register a question, please press star followed by the 1 on your telephone keypad. If your question has been answered and you would like to withdraw your registration, please press the pound sign. One moment for your first question.
While we're doing that, I'd like to thank Barbara Wyckoff for her comment in the chat section. I do think it's important to bear in mind what she mentioned about the fact that PRIs need a change in mindset both at the foundation side and the recipient side. Thanks so much, Barbara.
This is Sandra. I wanted to respond to that too, just from our experience in working with nonprofits that were inspired to use a social enterprise model, but learned the hard way, and so did we along with them, that there are certain key skill sets and capacities that nonprofits don't always have that social enterprises really need. And often that falls in the along the lines of financial capacity that really allows and the knowledge, the business development knowledge that not all nonprofits have. And we've learned that some grants to invest in that kind of capacity can pay off really well, and you can avoid some hard lessons later.
Great point. And sometimes the grant may go not just to the investee itself, but may go to a local organization that provides technical assistance to emerging businesses or nonprofit organizations. We have a question, will the slides be available to download? I would certainly be more than happy to share the slides for downloading.
Well, and Jane, you may not have heard, but I mentioned that we'll be working with Rural Support Partners to get them on the Appalachia Funders Network website.
We don't have poll taking on the call, but it's I hope that there are some foundations on the call that are thinking about impact investing as part of their toolkit. One of the things that's striking to me when I look at this map on the front slide is that, as Sandra said, Appalachia has some absolutely wonderful CDFIs and partners that can help foundations to channel capital into communities in a prudent way. And therefore, part of what we need is greater involvement by foundations in working with them to do that. And sort of, I'd love to see over time some of the coloring on this slide to change. And I firmly believe it will change.
Maybe while we're waiting for the next question, Lisa, I can share a little bit about Foundation for a Healthy Kentucky's effort currently, which is sort of a transitional effort called Investing in Kentucky's Future. We characterized our investment in 7 Kentucky communities as a grant investment, but we offered training and technical assistance, some of it from MESAD and some of it from a business planning consultancy, on how to develop a bankable business plan so that they could identify a sustainable community project that would make some impact on improving the health of children as they grow into adults. And we did find that the training needs were significant. And one of the problems or challenges that we encountered in funding local coalitions to do this work is that the depth of the bench was not great. So even if they sent 2 or 3 people to each of the trainings, as the 5-year relationship progressed, some of those people went on to other jobs, and the learning transfer became something we really had to pay attention to. But we did use MESAD for the initial training for those grantees. And some of the nonprofits still struggled very much with the concept of a bankable business plan.
You know, Susan, I'm reminded of one of the sayings that goes around in the impact investing circles, and Sandra has probably heard this, that PRIs are not bad loans or mean grants. And I think it goes, they're not mean grants or bad loans. But the bottom line is, as we think about PRIs as a tool, clearly, if you hear your approach and Sandra's approach, it's not instead of grants. It's to enable us to go further than we can go with grants alone. And oftentimes the recipient needs to understand that they may get a lot more money with a loan if they can qualify for a loan, and this may help them to do some of the things that they very much want to do a little bit sooner. But I think we've heard clearly on the call that that we never want to give a loan before an organization is ready for it. So the readiness steps are critical.
Is there anyone waiting in queue to ask a question out loud?
There are no audio questions at this time.
Well, thanks so much, and we've finished all the chat box questions, so I guess we'll be wrapping up a little bit early. Again, thank you all so much for putting your toes in the water on impact investing. If you're excited about the possibility of working collaboratively with other funders to advance the Appalachian transition, I'm going to put in a shameless plug for the next in-person meeting of the Health Working Group. It's going to be in Charleston, West Virginia, November 5 and 6, and we welcome folks from other working groups of the Appalachia Funders Network who see opportunities in communities to curb the growing obesity problem by access to fresh foods and building more walkable communities and safer communities for people to be actively outdoors.
And this is Sandra. May I put in another shameless plug as well? There is for anyone that really wants to dive a little deeper into mission investing, there is a Mission Investors Exchange is holding an institute in Atlanta in late September. And it's a great way to really just dive deeply into the nuts and bolts. And Lisa will be the primary faculty for that, but we can send that out to folks that were on this call as well.
I believe that's September 28th through 30th. Is that right, Lisa?
Yes, it is. And part of the joy of those institutes is not only the ability to do the deep dive, but also the relationships that the participants form and it's really a network for working together, co-investing, bouncing off ideas, and so on. So I do encourage folks on the call to think about it. Also, Susan, I see that Barbara does have one question.
Okay.
Barbara?
Blurt
Do
it
you want
out,
to try?
Please make sure you're off mute. Oh, I'm sorry. We may need Angela, our facilitator, to let Barbara ask her question.
Yes, Barbara's line is unmuted.
Thank you. Thank you so much. I did the *1 and somehow didn't quite work. Anyway, doesn't matter. I'm with the One Foundation, and I want to make a plug, I guess, for another tool that that Lisa definitely mentioned in that one diagram that shows the continuum of investments. But it's about loan guarantees, and I love CDFIs. I'm all about CDFIs, but CDFIs also have limitations about what kind of risk they can take. And sometimes even a CDFI can see a great deal, can see a great place to invest, and aren't able to because they actually cannot take on the level of risk for many of these kinds of organizations and businesses that we're talking about. So I think a great role for foundations is to provide loan guarantees. It's like having your mom and dad co-sign for your house. And I really feel so confident because I do the loan guarantees in collaboration with CDFIs, so they've done the heavy lifting, they've done the underwriting. I really feel that that it's not that my loan guarantee is not at risk, although I'd be totally prepared if it being at that bottom level of the house that Lisa described. It's sort of first floor. I don't think it's basement, but first floor. It could happen that we would lose our investment because we would have to pay back a loan for someone who defaulted. But I think that's a great tool in addition to PRIs, not to lose track of.
Thanks so much for mentioning that, Barbara. Here at the Foundation for a Healthy Kentucky, we also made that our first toes in the water step into impact investing, and we put on it the proviso that this would be for folks with whom we'd had a past grantee relationship. So that was an added screen that our board had put on it to give us a little more comfort as we moved into that space.
Great, and I would just add, you know, Lisa, I so appreciate this. I always learn something new when you speak, and really what I took away from this, it's kind of obvious, but it meant a lot to me that PRIs are not just another loan. I really was struck with the targets, the importance of screening and setting metrics, and really interested in hearing more on future conversations about the impact investing life cycle, sort of where we can, on the foundation side, some of the steps we need to go through. And I know for the One Foundation, we have not gone through all of those steps. We've gone through some of them, and I found it really helpful to think about how we could up our game by actually going through and intentionally thinking about that investment life cycle. So thank you for that tool. I really appreciated that.
Thank you. And Lisa, let's give you the last word. We have 2 minutes remaining. Or 1 minute.
Well, my last word is what fun it is to work with all of you. How excited I am to come to Appalachia in November to the meeting that's taking place on November 5th and 6th. I hope some of you may come to Atlanta for the immersion in impact investing at the end of this month. But most of all, what really all of that is about is the longer term work that I think we're all committed to in the Appalachian region. And I really look forward to many phases of that to come. Thank you.
Thank you, and thank you all, and have a great Labor Day weekend.